Dean, I've been told the problem I'm having and the cause of my sciatica is because one hip is higher than the other and my spine is curved. Hi there, my name is Dean Volk. I'm an international sciatica relief expert and founder of Sciatica Relief Now, and I love answering your questions. Question I get very, very often, and something that is extremely common, is one hip is higher than the other, or I have a scoliotic curve in my low back, and that is the cause of my sciatica or piriformis syndrome. I've been told this many times by many of my clients in the past, and I'm here to try to debunk that to some degree. If your hips were not uneven before you had your sciatica or piriformis syndrome, and you did not have a scoliotic curve before you had sciatica or piriformis syndrome, or got diagnosed with a bulging disc, your problem most likely is not the curvature of that spine or the unevenness of the hips. Dean, how can you say that? Because so-and-so told me that was my problem. So-and-so told me that was my problem. How can you go against what I've been told? I'm not knocking them, and I'm not saying that they are 100% wrong, because that's their frame of thinking. But let me ask you, if you've ever seen a skeleton in the corner of a doctor's office or a chiropractor's office or a physical therapist's office, did they do much moving? Were they able to reshape their position without an outside force moving them? No. So guess what? Your spine is your spine. And guess what plays on your spine? And guess what plays on your hips? The connective tissue around it, the muscles. Now, if you've got a disc issue that's causing your muscles to do this on one side of your spine, guess what that's going to do? It's going to take your spine and it's going to appear to be curved. If you've got, say, a right-sided disc bulge or right-sided muscle spasm in your low back, guess what that's going to do to your gluteal and pelvis muscles on that right side more so than the left? They're going to contract. They're going to pull up that right pelvis area, that right hip area, and it's going to appear like you're crooked, whether it be a couple centimeters to a couple inches. When you've got tightness on one side of your body, especially in your low back, that is going to affect your spine because it's going to cause it to curve in, and it's going to pull your hip on that side up. So is that the cause of your sciatica? Is that the cause of your disc issue? No, that's a result of it. My focus would be, let's calm down the muscles. Let's balance out the muscles. Let's stretch out the side that's looser, more comfortable, less restricted. Let's see what we can do to even out your muscles, because what that's going to do, it's going to release the muscle tightness that's causing that pulling in the spine, that's causing that pulling of that hip to rise. I hope that makes sense. And actually what I do, I have a lot of people who come in and they got that normal hip shift because their back's in so much pain. And so many times I see them trying to push their trunk over their hip and their hip underneath their trunk to straighten themselves out. And it's killing them and it's hurting them, but they're feeling like they're straighter, so they feel no pain, no gain. And I tell them, let's try something else, because obviously that's not working for you. So I actually take them and push them further into that position, or have them tip further into the abnormal position that they came in. And the further I push them, the better they feel. I do that repeatedly. I hold them in that position for some time, and then we see what happens. And more times than not, they're actually straighter. Their hips are more level. Things tend to calm down. So the next time you're told that your problem is your hips are uneven, and that's what's causing your sciatica or piriformis syndrome or your disc to be a problem, or you've got a little bit of a curve in your spine that you never had before you had this pain, think again and try to figure out, how can I loosen up the muscles that are so tight? And I believe that that will help immensely. I hope that makes sense. I hope you enjoyed the information in this video. If you did, please give me a thumbs up. Please click the subscribe button below. And in order to join 8,000 plus people who are on a journey to freedom and hope from sciatica and piriformis syndrome relief, please join please join my Facebook group called Sciatica and Piriformis Syndrome Relief Group. I hope you have a wonderful day.